Cardiac surgeon warns this sleeping position raises stroke risk overnight. As we age, the elasticity of our blood vessels changes, and the valves in our veins have to work harder to return blood to the heart. Many seniors find themselves naturally gravitating towards sleeping on their backs, but for many, this is the most high-risk position available. When you sleep on your back, gravity causes the soft tissues in your throat to collapse and the tongue to slide back, which can lead to obstructive sleep apnea. This isn't just about snoring. Every time you stop breathing, your oxygen levels plummet and your brain sends an emergency signal to your heart to jack up the pressure. This sudden midnight surge is a primary driver of strokes and heart events. Your brain is a high-demand organ that requires a steady, unwavering supply of oxygenated blood. If your sleeping position is causing your heart to struggle against restricted airways or compressed vessels, you are essentially putting your system under a stress test while you sleep. By shifting your position, you are choosing to remove that mechanical burden, allowing your cardiovascular system to operate in a state of ease and efficiency. This is how you proactively guard your longevity. The most recommended position for senior heart health is sleeping on the left side. From a biological perspective, this position is a game changer because of the way our organs are situated. Sleeping on your left side allows the heart to pump blood more easily because the aorta, the body's largest artery, curves to the left. Gravity actually assists the blood flow away from the heart and down to the rest of the body. It also prevents the heavy weight of the liver from pressing against the large vein that returns blood to the heart, ensuring a smooth circular flow of life-giving oxygen. Furthermore, the left side position is a powerhouse for your lymphatic system. Your brain actually has its own specialized waste clearance system called the glymphatic system, which is most active during deep sleep. Research indicates that side sleeping is the most efficient position for clearing out the metabolic waste products that can accumulate in the brain. By sleeping on your left side, you are essentially giving your brain a deep clean every single night, reducing inflammation and supporting long-term cognitive clarity. It is a simple shift with massive biological rewards. We also have to address the stomach sleeping habit, which is arguably the most taxing position for a senior's neck and spine. To breathe while on your stomach, you must turn your neck to an extreme angle for hours at a time. This can put significant pressure on the vertebral arteries that run through the bones of your neck. If these vessels are already narrowed by age or other factors, this prolonged twisting can further restrict the blood supply to the back of the brain. Moving away from stomach sleeping is a vital step in protecting your structural and vascular integrity. If you are a lifelong back or stomach sleeper, you might find it difficult to stay on your side. This is where sleep engineering comes in. Using a long body pillow or even a rolled-up blanket placed behind your back can provide a physical barrier that prevents you from rolling over in the middle of the night. It takes about 2 weeks for the body to calibrate to a new sleeping position, but the effort is well worth it. You are retraining your body to adopt a posture that prioritizes the safety of your heart and the protection of your brain. We also need to consider the elevation of the head. For many seniors, a slight elevation of the upper body, about 30 degrees, can further reduce the work on the heart. This prevents fluid from pooling in the lungs and helps maintain a clear, open airway. Many find that using a wedge pillow or an adjustable base provides an immediate sense of lightness in their chest. When you breathe easier, your heart rate stays lower and your blood pressure remains stable. This is the sleep sanctuary you want to create for yourself every single night. Before we get to that final pillowing secret, let's talk about the importance of the wind-down period. Your heart doesn't just shut off when you hit the pillow. If you are stressed or dehydrated before bed, your blood will be thicker and your nervous system will be on edge, making any sleeping position more risky. Ensure you are hydrating well in the afternoon and taking a few minutes to practice deep, rhythmic breathing before you lie down. This tells your heart that the day's work is done and it is safe to enter a state of deep repair. Now for that final secret to bulletproofing your stroke risk while you sleep: the carotid alignment. Most people use a pillow that is either too flat or too high, which causes the neck to tilt. To protect your carotid arteries, the main pipes to your brain, you need a pillow that fills the exact gap between your ear and the edge of your shoulder when you are on your side. This keeps your neck in a neutral position, ensuring that the vessels are never compressed or kinked. It's like keeping a garden hose straight to ensure maximum flow. This one small adjustment ensures that even if your blood pressure fluctuates slightly during the night, the physical path to your brain remains wide open and unobstructed. You will likely wake up feeling more refreshed and alert because your brain has been receiving a high-quality, steady supply of oxygen all night long. This is the ultimate passive health habit. You aren't doing any extra work. You are simply setting the stage for your body's natural healing systems to function at their highest level. Your health is a 24-hour-a-day process, and the hours you spend asleep are some of the most critical for your long-term vitality. By taking control of your sleeping position and your pillow alignment, you are showing a deep respect for your body's complex biological needs. You are refusing to leave your safety to chance. This level of intentionality is what allows you to age with power and maintain your independence for decades to come. You have the knowledge, and now you have the plan to sleep with total peace of mind. I want you to go to bed tonight feeling like you've built a fortress around your heart. I want you to feel the ease of breathing and the comfort of a body that is perfectly supported. These small mechanical changes are the hallmarks of a proactive, informed senior who understands how to work with the laws of biology. Stay consistent, listen to your body's signals, and enjoy the deep, restorative rest that you have worked so hard to earn. Thank you for joining me today and for being a champion of your own health. It is an honor to help you navigate these important shifts in your lifestyle. If you found this information about sleeping positions and stroke risk helpful, and you want to keep learning the most efficient, up-to-date health tips for your golden years, please subscribe to the channel. We are a community dedicated to thriving and living our most vibrant lives together. I look forward to seeing you in our next video. Sleep well and stay strong.